Good evening, everybody. This is Anand here from Clinsav team. Welcome to today's webinar. We would be starting in the next 1 minute. Okay, good evening, everyone, and welcome to the Gyaan Vardhini session 15. I'm Anand from Clinsav team, and I thank each one of you to join us today as we embark on yet another enlightening journey of wisdom and knowledge enhancement. Before we begin, I would like to share a brief overview of the amazing Clinsav app that we have been developing over the last 5+ years. Clinsav means clinic savvy, and it is the only mobile-based clinic management app in India that allows you to manage your clinical practice in a full and 100% offline mode. It has a very simple design. Clinsav helps doctors easily manage patients, appointments, case papers, full prescriptions, bills, fees, issue of issuing pre-filled letters, managing finances, doing follow-ups with patients for outstanding dues. Clinsav also sends automated appointment reminders 1 day in advance to your patients through SMS, and it also gives you the ability to simply swipe and send custom WhatsApp messages to your patients. Now we shall be starting our today's webinar with Dr. Ahmed Savani. Our today's webinar topic is Ayur-Emergency, scope of Ayurveda in acute emergency conditions in cancer and severe critical illness. Our distinguished speaker for today is Dr. Ahmed Savani. Dr. Ahmed Savani is an Ayurveda Acharya with an MD from GAMRC, Goa. He has 5+ years of experience and he got his certification CRAV from Rashtriya Ayurveda Vidyapeeth from New Delhi in 2020 on disease diagnosis, treatments, and drug formulations. Dr. Ahmed is a practicing Ayurveda consultant at Blessing Hospital Multispecialty Surgical and Integrated Ayurvedic Oncology Center, Surat. Dr. Ahmed has been working as a Nadi Vaidya, Rasa Vaidya, and Ayurvedic iridologist since 2015. He has a very strong inclination towards Ayurveda oncology, Aushadhikaran, and clinical research in Rasa Shastra. Currently, he is also working on an innovative startup project funded under GSBTM, that is Gujarat State Biotechnology Mission, DST, Department of Science and Technology of Indian Government, Government of and Bhasma Gamitwa, targeted drug delivery, Ayurvedic nanomedicines in cancer, as well as acute emergency and chronic diseases. He is a core team member of Ayur-Emergency project under Ministry of Ayush and RGUHS, that is Rajiv Gandhi University of Health Sciences, Bangalore, which was initiated last year and having a multidisciplinary team of modern doctors ranging from oncologist, oncosurgeon, hemato-oncologist, and from Ayush system of medicine, Ayurveda, Rasavedya, Netravedya, Vishavedya, Siddhavedya, homeopathy, biotechnologists, nanotechnologists, musicians, statisticians, mathematicians, etc. Dr. Ahmed, we are honored to have you with us today to conduct this webinar. Let us all welcome Dr. Ahmed Savani for today's session. Dear sir, you can start with your session now.
Thank you, Anand sir. Am I audible enough?
Yes, sir.
Okay, and my slide is visible?
Yes, Dr. Ahmed, your slide is
Okay,
visible.
okay. Thank you so much for first of all to this platform and the initiators. Um, so as you can see, for tonight we have this topic of discussion on Ayur-Emergency. It's one of the more spoken and less touched area of medicine in general, called emergency medicines. and what is the scope of Ayurveda in it when it comes to acute emergency conditions and critical illness. Particularly, cancer is something of my core interest. So that we'll be discussing. Now, before, is it slide moving?
No, sir, we cannot see the slide moving. It's still on the first one.
Okay. Is it?
Yeah, it's moving now. Yeah. Thank you, sir.
Okay. So before beginning this topic for today, I just want to briefly discuss regarding the voyage of Ayurveda for me. As you can see on the right hand side, there's two important figures who has been the most important pillar of my journey of Ayurveda is my father. It was his dream to be for me to be in Ayurveda, to pursue my career in Ayurveda, because I was someone who was very much interested in biotechnology and the research aspect of area of clinical medicines instead of going to be a doctor. So he was the person, who wanted me to be pursuing Ayurveda. And another one, I was very grateful, and it's like a blessing for me that I got Vaidya Tapan Kumar sir as my first guru in Ayurveda in the very first year, as he was the main person who has shaped my journey, and particularly my interest in cancer and in particularly emergencies, in coming to Ayur-Emergency thing. So before starting, I just want to pay my tribute to my Vaidya Gurujans through whom I have learned, whose teachings I will be talking about, and whose learnings I will be able to carry forward. So it is like I always say, if I've seen further, it is because I'm standing on the shoulders of these giants. And I wonder who those giants were. These are my giants, is Vaidya Tapan Kumar sir, who is the renowned Ayurvedic oncologist and cardiologist practicing in Ahmedabad, and my RAB guru, where my journey of being a Rasavedya or Rasa Shastra started with Vaidya Vivek Sane sir and Vaidya Gopi Krishnan sir, through whom I was able to learn some of the preparations of potalis and several other things, clinical aspect. And I think I was very fortunate enough. I think I'll be one of the exception who has been a part of the OPDs of Vaidya Samir Jamidagni sir, who is practicing in Pune. Uh, I was not been part of that 18 months of teaching system that he had, but I was able to attend his OPD for 3 months when I was been doing RAB over there. So this peoples have shaped, and there are several other gurus. I want to be grateful to my teachers and all. So I think when patient comes to us is not by walking, not by car, not by cycle, but on the path of faith. And this is something very important, I believe, what makes us distinguish from other uh, people who are having different sorts of careers. So being a Vedya is something we should be proud of. Now, this is something which Anand sir has given you the idea of one of our project. It's like a startup biotechnopreneurship project, which I'll be say I'm very happy to share with you all. It was got selected and funded under GSBTM, that is Gujarat State Biotechnology Mission, under DST, Government of India. And we were very fortunate, and we were featured under Vibrant Gujarat Global Summit, which happened to be last year in 9 to 11 January 2024 at Gandhinagar. So this project is basically about Bhasma Gamitva, where targeted drug delivery Ayurvedic nanomedicines, where basically I'll just give you an idea how just by changing the Shodhan Dravya or the Maran Dravya or the Jaran Dravya, which is the part of the process of preparing Bhasmas, Bhasmigaran, and just by changing these dravyas, how we can change the Dhatu Gamitva of that particular same Bhasma. Like for an example, you all are well of Abrak Bhasma. When we use Shodhan Dravya for Abrak, Gomutra, it act as a Aptarpana. If we use Godugdha, then it act as a Santarpana. Now, this is the mode of mechanism, how these bhasmas are going to act in our body. But even changing the Shodhan Dravya, Maran Dravya, and this Jaran Dravya, or the Bhavanas Dravya that we use for preparing bhasmas, we can give the particular Dhatu Gamitva, which particular dhatus, like out of Sapta Dhatus, or out of which avyas, the organ affinity and the tissue affinity of that bhasma changes. and how by just like, for example, another example I'll give you, that how this Jashad Basma, if you use Jyotishmati as one of the Jaran Dravya, so it will be more acting toward the retina or the ophthalmic like conditions. So like diabetic, this the diabetic conditions like that we had in retinopathy and all. So this is something very important of this study we have taken, and this project was been selected under this. Now, moving toward the journey of cancer, how it all started. So, from the very beginning, from my high school studies, I was something very interested about the cancer. And I think it was in the very first year of my BMS. I happened to find out this person, Dr. Late Manu Kothari sir, who is truly genius. And he's from Mumbai itself, who has been working at CGS Medical College in Came Hospital. So I was very fortunate to meet one of his co-author in all of the work, Dr. Lopa Mehta, in 2015, when I was in my second year of BMS, out of my interest to know more about their works in cancer and what exactly some of their books and all. So this book, which you are seeing, this Nature of Cancer, this was been gifted by Dr. Lopa Mehta when I was in my second year, and I met him personally at Came Hospital. So this book has given me a lot of idea how the cancer to be approached, even from the perspective of Ayurveda and modern medicine. So this is how it all started. And this Dr. Manu Kothari, he was my huge inspiration and encouragement to work in cancer. And last year on World Cancer Day, I mean, it was not been destined, but I got to meet once again with Dr. Lopa Mehta ma'am, and we discussed about the emergence of novel therapies of cancer and the role of integrated Ayurveda. Now, I just want to focus on this. Integrated Ayurveda is not something where the modern oncologists like oncophysician, oncosurgeons have been treating with their line of treatment for the cancer patients, like designing the chemotherapy, radiation therapy, or going for a surgeries. And where this patient is also been treated by the Vaidyas, but there is no crosstalks between these two faculties of medicines. So this is something where we are just cocktailing of to these treatments, and we don't know whether this treatment has been benefiting or harmful for the patient. And sometimes it is harmful because right now we know that it is not necessarily that every cancer patient will be benefiting from the Ayurvedic treatment. So uh, how we can extend this role of Ayurveda beyond supportive, palliative, preventive offers cure. I mean, basically, we have always been taken Ayurveda for supportive, palliative, and preventive. But what if it can offer the curative aspect on early and right diagnosis of the cancer? How about we start with processing, I mean, developing the new protocols for treating cancer patients in India rather than just solely relying on the research studies conducted in European countries? So I got the opportunity to have this discussion with Dr. Lopa Mehta ma'am, and we come to some of the conclusions that I will also be sharing in the couple of next slides. So these two legendary modern doctors, as of who were the strong opponents of Ayurveda, I think every one of us might be aware of Dr. B.M. Hegde sir and Dr. M.S. Valethan sir, late Dr. M.S. Valethan sir, who also been part of one of the motivator and one of my mentor for this startup project that got selected under DST. So basically, I believe when it comes to result-oriented practice, what we need is the nidana. Optimum nidan means the root cause when it comes to any condition, either it is chronic, acute, or cancer, or any other condition. What we need to understand, we have to find out the root cause of that condition. So when it comes to my practice, obviously Ayurveda says that the nidan has to be done. So nidan. And second thing, which is very most important, which I come across after passing BMS, is the potent, the weaponaries that we have is the quality shastrot medicine. So even the medicines which I've been using as of now are majority 99% are all these shastro. It's not that I'm saying that all this proprietary medicines are not good, or I mean, basically, I think we have a lot of treasure of all these medicines we have. Why not we try up with new formulations that we have for different vyadhis, for different sampraptis? So I rely more on Shastrokta medicine and self-prepared one. So these are the two important factors in my practice. So I follow Nadi Pariksha, which I learned under Vaidyanathan Kumar sir. Now, Ayurvedic ideology is something another aspect of doing Nidana. That it's also the word. I think we are the first one who has coined this term called Ayurvedic ideology, which I'll be discussing if we time permits and if we have enough of time. And other thing is Udar Pariksha, Ashtavid, and Dashvid Pariksha. So all this method of examinations are very important when you want to have a result-oriented practice in acute conditions or in emergency conditions also. So now another aspect that we have is the association of AMA. So what so far the experience and of my teachers and what we have been training, we have understood that either there is an emergency condition in front of you or infectious condition, even autoimmune, there is always an association of AMA in that. There is so when there is an AMA, obviously there is the Agni, which has to be looked upon, which has been vitiated at the same time. And along with that association of arm, there is Udavart, where we see that the uh, Pratilom Gati of Vayu is there. When these two factors are been already there or developing the samprapti, the pathophysiology inside your body, and then there is a certain external force or the factor where what we understood from the Ayurveda is a pranagata vayu. When these three things come up, we see any kind of an emergency, either it's in the fashion of cardiac emergency or the neurological emergencies like stroke or like that. So in that we have to understand which particular entity is been affected more. So accordingly, we can start that treatment. So what aspects of dhatus there is an association, at which level of dhatus there is an association of armor, that has to be understood. And obviously, when it comes to nidan, this three important nidan along with Sahaj, that is the hereditary. These are the three importance Nidan that we can summarize or can be put into summarize the Ahar Nidana or Manasik Nidan, the stress factor and the Vihar. Usually we see what I have understood so far that several kind of respiratory emergencies or the emergencies that we get for like conditions of cardiac emergencies, there is an underlying pathophysiology of suppression of natural urges. There is Veg dharana. So we know that there are certain adharanya vega that we has to be not to be done. So these things you can, when you ask the history, when you take the history in that particular fashion, you will be able to understand it. That this particular Mutra Veg dharan is there, Mal Veg dharan is there from a long period of time. And this is resulting into the Udavart and this Pranagat Vayu, this kind of emergencies. So that has to be also think from that aspect. Now, this is something which I believe is the uh, that you are seeing on the left hand side is the Ayur emergency kit. So basically, I believe this is something to be carried for every Vaidya, either who is studying in UG, PG, or who is the practicing Vaidya. So this is something which is basically I have developed in such a way for my comfortability. So other Vaidyas are being. So basically, this concept was been inspired from several Vaidyas who were having this small kinds of kit. First of all, it was Vaidya Tapan Kumar sir. Many of you might be aware of 19-minute protocol of cardiac emergencies. So, and several other Vaidyas were been carrying all these medicines like Putali Kalpanas, some kind of Lepa Kalpanas or medicines with them. So I thought, why not we have certain kind of a kit? So you will also be able to see that this was not the kit from the very beginning. I had just 6 to 8 medicines with me earlier, and then later on it got evolved as per the need of the condition, need of the patient, like that. And at the same time, I just thought, obviously there is no such need of like a setup or some kind of infrastructure that we need to conduct panchakarmas. So what if we want to conduct, there is this dosh, uh, particularly dosh pradhanta is there. So we want to conduct sadhyo vamana, sadhyo vireshana, sadhyo nashya, so sadhyo rakta mokshana. Agni Karma, Vidya Karma. So all this thing, if you want to do in emergency, then you should have all these tools with you. So we developed this Sadhyo Panchakarma kit. I'll just be giving the brief what exactly we are keeping in this particular thing, and I think every Vaidya should do some kind of modification as per their need. So you can see this evolution of Ayur-Emergency kit that we had. From the very first time, I just gifted this to by the Tapan Kumar sir, and you can see in that there are just 6 to 8 medicines in that, and there is small khalva yantra is there. Some needles are there for doing with the karma. Then there is a matchbox and lighter is there for doing Agni karma like conditions. And then you can see on the right hand side. So this is something an Ayur emergency kit we had. So for several different sampraptis, for several different vyadhis that we get in emergencies, either of Udar Shul or Shwas Veg is there, or there is vomiting, emesis is there, there's a bleeding is there. So this but certain kinds of medicines that I'm having are enough to fulfill all this need. We have kept for burns like condition, Satudodgrut. Then there is a small khalva you can see where if you want to give certain, so basically all these medicines I've kept in the form of tablet and potalis. So when you just want some medicines to be given sublingually, then you can just crush this medicine into churna form in this khalva yantra, and you can give it to sublingually. And then there is a Hingu Vachadi oil that you can apply for local application, like that. And I have almost some 8 to 10 potli kalpanas like Abragarbha potli, Tamragarbha potli, Lakshmi Vilas potli, Rasa Sindur potlis. So these are some of the potlis that I have kept in this. Now, similarly, another kit that we should have is something which I have developed, which we have developed is Sadhyu Panchakarma kit that you can see in this. Uh, there are some of the tuners that we have kept for Lodra, Nimbasal, Haldi, for Rakta Stamban like condition. If you want to do Rakta Mokshan and there is bleeding is not stopping, then we can have all these Rakta Stambak tuners with us. Then I'm having for Nashya is the Gugrut Manda Nashya is this bottle is you are seeing is there. Then for ophthalmic like condition, we have Netra Rasayan eye drops, Ashutan for doing Ashutan. Then you can see on the right hand side, there's small one glass uh, bottle you are seeing. It is nothing but the Shunti Churna that we have kept for doing Pradhama Nashya. And you can see there is one rubbing stone is there for Potali Kalpanas, gloves is there. We have kept some small bandaging for doing bandaging or for run prakshalan. Also, we have one liquid is nothing but Panchavalkal Kuat. Then for doing with Agni Karma, we have different shalakas like Panchadhatu Shalaka, Rajat Shalaka, and honey, like that. So these are certain things that we have kept under Panchakarma kit. Now, coming to the main core of particular cases, I have compiled to be discussed tonight. So coming to the case number 1 is the Ayurvedic emergency management of Shwaskastrita. AECOPD was the condition, and that also during the journey inside the train. Anand sir, are you able to see this slide?
Yes, Dr. Emil. I
Okay.
can see the slide. Yes.
Okay. So you can see this patient, the history was like that. I was traveling from Mumbai to Surat in the month of February last year. And during that time, obviously, when we travel, we used to give, book the ticket under the name doctor or Vaidya. So that TC was knowing. So he came down around the time of 10:30, 11 at night. And during, he just told me that, sir, there is one patient, there is one person who is not able to take breathing properly and he not able to take this inhaler, not able to use the inhaler properly. So can you just come and please check this person? So when I went to this patient, he was actually lying under the lower bed that we have, lower, middle, and upper berth in the train. He was lying under the lower berth where we keep the luggage. He was sleeping in that thing. And there were so many passengers around. There was so much of suffocation. So we just, first of all, with the help of the other passenger, we take this patient. person on the lower berth, and with just checking some nadis, tongue diagnosis, looking at the eyes and all, patient was not much conscious and oriented enough, and I was having this pulse oximeter. So when we put this pulse oximeter, you can see the condition. So what happened at this time, as you know, there is a current fashion right now. If there is any kind of such situation happen anywhere in any public, there are people who try to record this thing. So later on, after this thing, I just obtained this video from this patient to have a documentation of this kind of conditions, that how we try to manage or tackle with Ayurveda. So I just try to play this video and let me know if you are able to see this, the vital of this patients. Were you able to witness the vitals of this patient? The SpO2 was 0 and pulse was 139. So you can see this condition of the patient. And in that condition, I'll just give you the history. When I asked this some of this family member who was traveling with them. The patient was very poor. He was not having any ticket, and so and I just asked them. There was some bandaging, if you can see on the hand. So I thought patient might be hospitalized somewhere. So I asked, do you have any file? What was the condition before? So in that kind of history taking, we were able to find that the patient was a known case of COPD from last 10 years with hyperbilirubinemia and severe anemic. And this patient was taken the Dama from the Virar Medical this hospital. And now this was actually a high risk patient. Either it is a modern medicine doctor or an Ayurvedic physician. We don't know what to be done. So just understanding this condition, as I was having the kit with me at that time. So you can see I just manage this condition with one Pradhama Nashya of doing Shunti and giving the potli rubbing of Swaska Chintamani. And just within a 15 to 20 minutes after that, patient started getting back normal, talking with me. And from SpO2 0, you can see it went to 82 and his pulse came down to 102. So this was the outcome of the emergency Ayurvedic management, where you can see, and this was the condition of the patient. As you can see on 5th of February 2024, this is the case of COPD with hyperbilirubinemia and severe anemic. How much severe anemic it was? The RBC on the right hand side, you can see was 1.93 and hemoglobin was 7.8. And SGPT and SgO2 were around more than 253 and 146. And you can see on the left hand side on the follow-up, today the patient was been given DAMA and the relatives were been explained that it was a high risk condition. So before doing anything, any kind of approach, I just first recorded a consent from the patient's family member, because I know that these things can be given in this Swaskastita condition, but we don't know what will be the, prognosis of this thing. It was a high risk, obviously needed oxygen, but at that time there was no oxygen facility in the entire train, not at the nearest railway station. And then later on, what happened? Patient got stabilized. But looking at the condition, what we did, we just advised him that on Surat railway station, let us just see if there is an availability of oxygen is there or not. But over there, there were some facilities of oxygen was there, but there was no oxygen in the cylinders. So we called the ambulance and the patient was taken to the nearby hospital. But at that time, patient was stable. He wanted to continue the journey, but he was able to reach his destination 2 days later on. So looking at this condition, we advise that at least patient should get admitted. But this kind of all this condition was been managed exclusively with Ayurveda, and all this documentation of the history and this thing. We presented this case under one WhatsApp driven one BMG group is there, British Medical Journal group, in which there are majority of the Ayurvedic modern doctors are there. So when I published this case was been published in the portal blog post by the senior most MD modern medicine physician, Dr. Rakesh Bishwas, who was the former director of BMJ. And he was the HOD of medicine at Kamini Institute of Medical Science. With this link, you can also go through this entire case. and this case was been published by the Modern Doctor. So this was a very much what you can say an appreciation we got from these doctors, and for them also it was a very astonishing that this kind of a COPD condition can be managed through Ayurveda. Now, another case of COVID during the COVID, I think first phase, first wave, there was a condition of COVID where there was 80 to 85% lung involvement was there. Now, actually, in this case, there was one doctor, one of the colleague doctor from Banaskantha, Gujarat, approached us with one of the patient who was not able to find the bed in the hospital at that time, and he just shared us some detail of the patient that the SpO2 remain around 65 to 70 and known case of COPD, and the score was around 220, 25. So what can be done from the Ayurvedic perspective? So getting the little bit of history from the patient, the condition, we just started Lakshmi Vilasharas, and another medicine that we started was Suvarna Sushikharvati. Only these two medicines were being started at the interval of every 2 hours to be given. And later on, we were able to find out as we were having a constant follow from this doctor, I got successful result in 85% lung involvement patient. And you can see the reports. There was the involvement of 80 to 85% lung involvement was there. And later on, he was got bed also, but then also discharged within a few days. And you can see how this condition was completely managed with Ayurveda, and there was no oxygen requirement was be needed. And patient was hospitalized once bed got available for a safety purpose. And later on, it was discharged. So during that time also, our Ayurvedic medicines were going on. Later on, some other medicines were also given, like Manjishra, the Quath was been added and all, looking at the comorbidities and all. So you can see on 30th of April 2021, his D dimer was 670. And just within 2 to 3 days, D dimer got back to 130. And CRP was also raised. And that also came back to 12.8 on the following next day. So later on, the patient got discharged. And even after some few months, we got the follow-up. How is the patient doing? And he was completely doing wonderful just with Ayurvedic medicines. Now, another case, this case was post-COVID encephalopathy with type 2 diabetes. Also having CKD, chronic kidney disease was there. Now, this patient actually approached us when he was already admitted in the hospital. You can see the condition. He was some NRI patient came from USA and was staying in Mumbai and was been admitted in Mumbai. Looking at this condition, he was not able to recognize her wife also. Such condition was been there, and severe Shota condition was there. And we tried to establish a context and started giving Ayurvedic medicines in this setup. And later on, this patient recovered very well. But the important part was when we started the Rasayan Chikitsa in that. And in Rasayan Chikitsa also, what we given them was the Gandhak Raj Rasayan. The reference is the Yog Ratnakar and Mahatikta. This only two medicines were being given. And at the age of 78, we were able to witness that there was a hair growth on the scalp, which started, and also the black hair started coming. So what we say when the Rasayan Chikitsa, the role of Rasayan Chikitsa is such an important aspect that we were able to see a lot of changes on the skin aspect of the patient, his memory, his hair quality, blackening of hair, and several other aspects. And the best part was he was on an insulin. His insulin was being stopped. And right now, no allopathy medicines like metformin or anti-diabetic medicines are ongoing. And even Ayurvedic medicines are also being stopped. So this was the kind of achievement we were able to get this with this patient. Now, another case of Shwaskastata, COPD, where we were able to even stop the modern medicines, particularly for COPD and even inhaler. Now, this is very interesting case. As you can see, This patient's son approached us, uh, where his father was working in some of the pharmaceutical chemical industry, uh, and there were several other root cause which we were able to diagnose when the patient came us into our OPD. And you can see he was suffering this COPD from since 2016. He was having severe infection of lung where he underwent two surgery and part of the lung and the ribs was been removed. And his age was around 57 and he was almost surviving on single lung as he was been mentioned by his son. Then this patient reached us through online through some word of mouth. And then later on, when this patient was trying to come to our OPD, but because of his condition like that, that every year from 2016, uh, what happened that every year he was been admitted to ICU for 3 to 4 times. And we were able to understand why he was been admitting because of the Pragnaprad. Some of the diets he was been taking, Vihar, and all these things were there. After a year later, when the patient when approached us again, driven by confidence in Ayurveda, you can see when the moment he discharged on 29th of June, where patient was still after discharge, he was still on BiPAP and oxygen support. You can see its SpO2 used to remain around 60 to 70% without oxygen whenever he got hospitalized. And he required hospitalization 2 to 3 times annually from for the past 6 to 7 years. And these were all the medicines he was been given, who he has to take from around from a long time. And at that time, oxygen support was been given around 7 liter per minute. This was the history of the patient. Now, when this patient came to us in October 2023, this patient is still under treatment. But the thing was, as you can see, we initiated the use of Ayurveda. Once again, this patient got admitted when he got back to his city, and we were not able to start the medicine immediately. But after some 15 days, when we started in some November 9, 2023, you can see the results just within a week. What we got, his Agni started improving. He started improving the appetite and digestion has been observed. Previous, he was not having not a no appetite and post meal heaviness. Udar Gauravta, Ura Gauravta was there. Adhaman was there. Even bowel movement got improved. Earlier, it was like he was used to have a severe constipation with extreme stickiness in the stool. Samakta condition was there, and overall patient was feeling much better and more energetic in last 7 days. In such a way that even from standing from the chair or to go for a shower, he was not able to do that because of the condition of COPD. Then just within a 7 days, there was no weakness, no breathlessness. And the interesting part was, as you can see, this were these. Now, this is the patient who was even at his home. He was having this BiPAP and oxygen thing to be given. And we were just giving him the medicines like Hemagarbha Potali, Praval Garbha Potali, and Swaska Chintamani Ras. And several other medicines were also, but these three major medicines were being given. And we taught the patient how to be taken this, how many rubbings has to be taken, just to give an idea how this to be done at home.
This Valentine's Day, scam the safe side. Share your special moments, and I will craft your love story powered by AI to gift your Valentine.
जीवन आवाज ओछो कर दो
जीवन साथी ऐप अब है फ्री मतलब
टीवी ना आवाज ओछो करो तुम
मैसेज को मैसेजेस भेजना उनसे चैट करना सब फ्री है तो आज ही जीवन साथी ऐप डाउनलोड करें
So we given the anupan of Madhu in this, and you can see this patient is rubbing here Hemagarbha Potli
चालू
of
कर
around
देन टीवी
30 rounds we have advised to be taken every 3 hours duration.
ये आज पति जस
Just give them a strong goodbye, then when you finish. What is the special with Valentine's Day?
So we have developed this measurement that around 1 rupee coin, if you're rubbing, it is releasing around approx to 1 mg at one round. So like this 30 mg, 50 mg, depending upon the condition, we were been advising to the patient on a daily basis how much doses to be taken. Now you can see this. Now live when this pulse oximeter was been kept, what was the oxygen and the vital status? And just by leaking this medicines sublingually, you can see under the tongue he's putting this medicine sublingually, because our potli kalpanas are being started working the moment they absorbed under sublingually. And even the result you can witness. Okay. Now you can see when this medicine was been given, at that time his oxygen SpO2 is 50 and pulse rate is 131. And just immediate after giving this, immediate, we ask the patient to give the photographs of these oxygen status after every particular timings, like immediate after that, after 1 hour, after 3 hours. So you can see just immediately from 50, it went to 88 and pulse rate come down to 110. Now this can only happens when this potali kalpanas or any of these medicines are being prepared as per the Shastrokta method. And even the quality is not been compromised, or there is no kind of shortcuts. And you can see this SpO2 went around 95 to 96. And during this time, there is no oxygen or BiPAP has been kept. That has to be taken into consideration. So right now, this patient, what we are able to achieve is that this patient is still on Ayurvedic medicines, but now all this modern medicines has been stopped. Uh, and even this oxygen from 7 liter per minute has been come down to 1 liter per minute has been given. And this still he has to take oxygen. But right now the condition has been very much improving. Even the patient has gained weight of around 7 to 8 kg. His weight was around 41, 42. Now it has been around 50, 52. So around 10 kg weight gain has been done in last 2 years. And patient is doing wonderfully. He's been able to carry out all his daily activities. He is able to walk earlier, which he was not able to do. But patient is still under treatment. And another aspect I wanted to share that even in last 2 years, patient got some kind of emergency like conditions because of the pragnaprad that the patient was following, some kind of diet he take, and then he lead into this condition where CO2 gets started increasing. And during that time, we just try to manage these conditions with this potali kalpanas, some Ayurvedic lap and all that things, and patient was being managed. So he didn't have to go down to this every time admitting in the ICU, and all this been patient condition was being managed at the household with the Ayurvedic guidelines. Okay, now this Ayurveda and one of the burn cases I have shared, I was not able to get more burn cases that we are having, which we have treated at our premises. So this is one of the earlier case. I remember when I was doing my RAV, this case was been treated by one of my sir, and we were been just managing this case with Shatudod Grut, and orally we were giving Lagu Manjishtadi Quat and Kaishur Guglu, but only Shatudod Grut application we started, where this patient initially went to Pune hospital. And over that, we remember that the patient was been given some kind of plastic surgery advice, which costed around 3 lakhs or something like that. And patient was not affordable because the patient was living some remote area, very poor condition. So over there, some RMO doctor suggested this patient to come down to this premise of Ayurveda, and we started this treatment. And just you can see in 3 days, on the third day, this patient changes in the skin lesion on the fifth day, then on the following seventh day, ninth day, 11th day, and 13th day. Now, when looking at the picture of the 13th day, you see no post-burn marks, no post-burn scars are being seen. So this was been just exclusively managed with Ayurveda. I was having few other cases of burns, but due to some technical glitch, I was not able to show it to you here. So this kind of cases we are being like right now every like 2 to 3 months within we get some burn cases, and we are just managing with Ayurveda. Of second to third degree burns we have managed so far. Now another case of lung adenocarcinoma case where the patient was been operated post-operative, post-chemo radiation therapy, just came with that severe breathlessness and Gabraman-like condition, where the SpO2 was around 50% and pulse rate was 150. And at that time, the patient came down in the period of COVID time. So we just try to show these cases in some of the conferences and some of the presentation lectures, where certain condition, where his one of the lung is was been occupied more than 50%, where just giving the Ayurvedic rasa ushadis and certain kashta ushadis also, like Mahalakshmi Vilas Ras was been given, Shatputi Abrak Basma was given, and Kantakari Avle was been given. And this with these three medicines, you can see just immediately after 1 hour, his SpO2 from 50 went to 74. But within that 1 hour, patient was feeling much better in his breathlessness and Gabravan. And his pulse rate also came down from 150 to 100. So this was just immediate after 1 hour. So this kind of documentation, when you show to the mass or the people from other fraternity, so then they will be able to understand how we are able to do these things exclusively with Ayurveda. Okay, now this is another case of Visham Jwar, dengue, where we were able to intervene at the time when the patient was being hospitalized and was not responding to the modern treatment that was being given at that time. Where you can see the patient was of age of 11 years, was a pediatric patient where dengue positive was there, and patient when diagnosed with dengue fever, he was having the symptoms like cough from 1 week. There was the Jwaravastha was there, vomiting was there. Whole night he was vomiting, couldn't sleep. And our Ayurvedic possible diagnosis and Nidan was Amajirna. Now, very important, we cannot just give this thing as a dengue and we treat it from Ayurvedic perspective. Like modern diagnosis and Ayurvedic treatment cannot go long way. So just Ayurvedic Nidan has to be done. So it was a Amajirna case in our scenario, Jwara, and there was a severe Viband. And importantly, out of fascinating, you can think even the apathya, like boiled egg, was being given in the Amavastha stage in the hospital. That was been going. So what we were able to see, this was before treatment. When the patient relatives approached us, you can see his platelet count was 20,000. 20,000. And you can see this was the high time when the patient actually, a family member approached us. We started Ayurvedic measures, initially just the medicated water, shoot jeerak and dhania, uh, and the strict diet and the personalized Ayurvedic medicines were being given. And the platelet count at that time was 17,000. This was the high time where modern treatment, whatever they were be giving, diet that what we were giving, it was actually deteriorating. Now, at that time when we started the medicines, you can see immediately on the same day at night, the platelet count went to 18,000. And the prime line of treatment at year was Agni Chikitsa and Shrotas Shodhan with Lagu Virechan and Anuloman thereafter. In just we have given Avipattikar Churna of the dosage which is been mentioned in Vaisheshya Ratnavali Amlapit Adhikar. That is 6 masa. So around 6 gram was been given. And this Virechan after that Viband was been resolved, and you can see the platelet count from 17,000 went to 18,000. Then on the next day, I think after 2 days, his platelet count from 18,000 to went to 36,000 just after 2 dosage only. Now he started having a good appetite. Motion was also being passed regularly. And this was during the treatment, you can see. This was the communication we were having is with patient relative, and we were giving the medicines. On 2nd of May 2021, you can see all these things have been reduced in just 2 days, and patient was discharged. And platelet count resolved to 1,43,000. And patient was discharged, and a patient was doing wonderfully. So over here, just Avipattikar Churna and Rasapachak, these two medicines were being given. But the important part was the Nidan Parivarchanam, because the patient was consuming the Apatya Ahar, like boiled eggs, heavy diet during this condition when the stage was of Amajirna. So when we had a proper Nidana, proper diagnosis, and we have the proper line of treatment, Agni Chikitsa, Nidan Parivarchanam, and Shruta Shodha Chikitsa, only just by following this thing, you can see the result within just 2 days. And patient was discharged, who was not early responding to the modern treatment, and the condition was deteriorating. Okay, now another case of macular degeneration, right macular scar, and in the left side, the macular edema was there. Now, patient was not having any known case of, uh, I mean, diabetes as such, or any cardiac condition, but he was a known case of hypertension. For that, some anti-hypertensive medicines were ongoing. I think the medicine was amlodipine. And later on, this patient's son, who was also an MBBS doctor, he found out this can be an amlodipine-induced edema. Pedal edema is there. In some patients, you can see who are taking amlodipine from a long time, they develop this short pedal edema. And the patient came down for macular degeneration. But looking at this picture, you can see there is a video of this, the level of short in this patient. So though the patient came for a macular degeneration of ophthalmic condition, we just treated the patient from the aspect of Shothar Chikitsa. Punarnavadi Kwath was being given, and uh, Punarnava Mandur. These two medicines were being given, and just after 5 days, you can see this shoth was reduced. And later on, just only Nashya Chikitsa, Gud Shunti, Shodhan Nashya, of what Gala sir we have learned from. We started this thing, and from day one, you can see the condition of patient, the swelling under the eyes, puffiness over the face. And on the second day, immediate next day, and the third day. So that kind of change you can see. Just only Nashya Chikitsa was been given, and orally this Punarnavadi Kwat and Punarnava Mandur. And later on, we started Netra Garbha Potli. That's the Praval Garbha Potli from Rasyog Sagar. And only this medicines were being given around 50 rounds for that, for the perspective of this macular edema condition. Now, the macular degeneration, which has already happened in the right eye, we we have no much scope. But later on, after some few months, like 4 to 5 months, patients started saying that I'm able to see little bit of improvement, some kind of flashes in the right side. And the left side, the number of injections that they were been taking under sclera, that has been reduced. So this was the improvement so far in this patient. Now, another case of Netra Rog, where you can see where we have developed this Netra Rasayan Ayurvedic eye drops. Actually, this story of developing this Netra Rasayan Ayurvedic eye drop was during the COVID time, where there was a lot of screening time and a lot of people were spending much time on screen. So at that time, people were started having this thing of irritation in the eye, burning sensation, computer vision syndrome, like this condition were blooming. So we just thought there are a lot of options available over the counter, even in Ayurvedic eye drops. But there is a preservative has been added, like usually sodium benzoate or some mercuryc hydrochloride has been used. So all these preservatives, when they are being added, what happened? They itself cause dryness. So we just thought, why not we develop some certain thing out of Arka-based Kalpana, and we are not adding any preservative in this. So this is a non-preservative Ayurvedic eye drop. And initially, we just started in our OPDs. Then later on, we started giving to some of the Vaidyas in our group. And right now, there are two modern ophthalmologists, one from Delhi and another is from Kolkata. They have been using our this Netrasan eye drops, and we are obtaining the data and feedback from them. So as you can see, this is one of the feedback that we received from one of the doctor from Ballari, who has been using this Netrasan for dry eyes. And he just mentioned how rejuvenating an effect has been there. So another case of this flashes and floaters. Now this patient was actually a scientist, and he was working at IARC, Indian Astrobiology Research Center, which is Center for United Nations. And he was spending much of time on the computers, reading books and all. So he was seeing these flashes and floaters from a long time. So initially what we did, we just find out to rule out any kind of diabetic retinopathy or something from the ophthalmology, but there was no such condition. So we just started this Netrasan eye drop and some correction in the diet and the regimen, early sleeping and like that. Just within a 15 days, his flesh is resolved and floater density reduced in 10 days. Right now, it's been, I think, more than 2 years. His floaters density has completely resolved and there are no such floaters. So after we find out that this is something we later on find out, we just started it's for rejuvenating effect, for dryness and certain condition that we have developed. These are the condition where this nitrosan can be useful. But this floater was something out of a box we able to find out. Later on, some other, I mean, feedbacks and the documentation that we have received from some of the doctors from Ahmedabad, a medical officer, where dry and myopia. You can see I was having a myopia and gradually developing a dry eyes. So earlier he was been using this lubricating eye drops, this refresh and all. But being a Vedya, he wanted to try some Ayurvedic thing. So when he started just this Netrasan eye drop, she told us that it's not only lubricating her eyes, but it also works as a stimulator. And the same thing she shared us that one of her colleague, when she was traveling and she started getting some kind of a redness, bleeding like redness due to something might have gone into her eyes. And she was having this Nitra as an eye drop in her purse, so she just asked her to instill that drop as something. And she told that she was not able to take the photographs or any further pictures, but it helped a lot. I mean, the bleeding, like this redness got reduced. So it just reduced. You can see it got feeling better in few minutes only. So this Ayurvedic things when we try to have it with us, so you can see how this kind of can be helpful to us. Okay, now Ayurvedic ideology, I think is something I think it will require another such kind of session. But I'm just giving one of this principle. I mean, one of this area that we are working since 2015, where what we have did is nothing but integrating the science of ideology with the Netra Chikitsa and the Netra Sharir thing. And just like we have this Nadi Pariksha, where we require a patient in person. Only then you can be able to do this Nadi Pariksha. But through Ayurvedic ideology, if you are able to send me the iris of any patient, we are able to do the diagnosis. I think someone has asked the question. I think we will take this question in the question answer mode.
Yes, doctor. We'll be taking the questions from the chat box once you finish your presentation.
Sure, sure. Okay, so this Ayurvedic ideology is something is first of its kind of our initiative on a global scale, where we have approached some of the ideologists across India and even outside India. And it's the integration of Ayurvedic Nitra Sharir and Chikitsa with ideology. As I Okay, so Ayurvedic ideology involves the examination of the iris through the perspective of Ayurveda's Netra Pariksha and Chikitsa, and its aim is to gain the overall insight into overall health, including the gut, organ system, emotions, thinking pattern, physiology, psychology, even the status of Agni, doshas, and Saptadhatu, Dhatu Saratva, Mala Samprapti, and doshas, Sattva. All this can be assessed just from the iris of the patient. So this is something which we are working, and so far we have successfully documented the data of iris of different conditions, even cancers, for over more than 10,000 patients. So this is something I think we can take later on. Okay, now this is the case of sleep apnea. This was the patient in 2021, a 46-year male with the weight of 130.7 kg. Known case of sleep apnea from 10 years, hypertension from 5 years on regular medicines, despite his pressure used to be, I mean, more than 2 to 3 medicines also, his pressure was around more than 150, more than 150, and BP used to be around 180, 90, despite antihypertensive medicines. And he gained weight around 30 kgs in 1 to 1.5 year. Earlier his weight used to be 82 kg. So this 5 years back, weight was 40, 89 kg. Now there was pain and heaviness in the left chest region radiating to the backside and shoulder. So even cardiologist did some kind of examinations to rule out any cardiac uh, condition or like that, but ECG and everything was normal. So our Ayurvedic Nidan was Ati Bhojan, Adhyasan, and Mutravek Dharan. Irregular diet and the lifestyle induced excessive eating and munching all the time, which lead to this Agni Mandya, which generate armor and Udavat causing Urdhva Gati of Vayu due to the Vekadaran habit. So our diagnosis was Amajirna, Udar Rog, and Stolya. And when we just started treating this patient from the Agni Chikitsa aspect, where Praval Panchamrut Rasvati of Arka Shir Bhavna, Praval Panchamrut Ras, because there's another Praval Panchamrut Ras where Godugdha Bhavna has been given. So this is the Arka Shir Bhavna from the aspect of Udar Roga, and Kalingadivati, where Indrayo, Indrayo, Shunti, and Mage. Only these 2 medicines, and for Anuloman, Haritaki was been given in the Apankal. Only these 3 things were been given in this patient. And you can see this patient lost 3.5 kg in just 12 days. But the important part was this patient was having a severe sleep apnea like condition. He get unconscious while traveling, while I mean on the two-wheeler vehicle, if he is traveling, he gets sometime unconscious in the middle of the riding a bike. So these were the conditions which were happening. So he was being advised to go for a BiPAP machine, but he was not affordable. So we just started, and this 12 days, there was not a single episode of such of this sleep apnea happened. And he was able to sleep. His snoring also got reduced just by customized Ayurvedic treatment, Prakruti-based diet, and lifestyle changes. Now, in Prakruti-based diet, what we basically do, we just for from the aspect of Agni Vardhan Chikitsa, we stop fermented diet, we stop dairy, apart from ghee and buttermilk in some patients, depending on the condition, we ask them to continue these 2 things, except these 2 things, the complete dairy intake has been stopped, and bakery. So fermented, dairy, and bakery. These 3 important things are being stopped. And only they have to take the diet if they feel hungry. There is no need of taking meal 3 times a day or whenever they feel hungry or like that. So this adhyasan was been highly reduced because that was the nidan root cause for this condition. So you can see uh, later on after 25 days, there was no complaints of sleep apnea. 80% improvement was there in palpitation and throbbing pain, which was also the one of the complaint he had in scalp. And his BP, despite of antihypertensive medicines which he was been taking, his pressure used to stay 180, 90, came down to 130, 80 normal blood pressure. And later on, I think after some 1 month, we even stopped hypertensive medicines with regular monitoring because his diet, I mean his vihar, everything was been under monitoring control as patient was following all the instructions. So you can see after 7 months, his weight came down to 110. And I think after some 1 year, he's right now around some 95 kg. And as this patient was advised, not advised any cardio or exercises because to protect his knee joint. So we have this kind of a protocol that if patient is having a weight more than 90, 95 kg, we do not ask them to go for any severe cardiac exercises or walking as much. First, we start to reduce the weight just by following the proper diet and medicines. and following proper vihar. So this was been done in this case. Okay, how much time we have left, madam?
Yeah, Dr. Ahmed, you can go ahead for another 10 minutes. Not a problem.
Okay, okay. So this is another case of CA lung and CA breast case from Paris. One of the Ayurvedic doctor only referred this case to us, who is the part of this our group. So this is the case where you can see we ask the patient when someone is approaching us from the teleconsultation approach, we ask them to send us the photographs of their understand overall build, show the condition for that this photographs. Tongue, you can see the pictures of tongues. This is basically a picture of tongue that you used to see in several different kinds of cancers when you are saying. It's very much crooked and Samta has been there. Udar Pariksha, we don't be able to do the palpitation and the other modes of abdominal examination, but we can see just visually we can get an idea several things of how the Adman is there or any kind of any other abnormality is there. So that kind of history we can get it from the patient, and this were some of his scanning reports with that. And the patient was actually very interesting that 75-year-old female, and thing was she doesn't have any history of cancer in the family. I mean, his parents or grandparents, but she was having three sisters, and all of these three sisters were having either of the lung cancer, skin cancer, and I think another cancer she was suffering, and all of them, two of them actually expired because of that. So she was very much after going for a chemotherapy, radiation therapy, even surgery. She went for uh, she was worried that as the doctors over there who were treating the oncologist, they told her if she goes for the immunotherapy, then she will be able to survive more than 1 year, but don't know how much. And if she's not going for immunotherapy, she will not survive for even a year. So at that time, this patient, when come to us, we just try to understand his detailed history. Obstetric history was been taken as she was having a long history of having contraceptive pills. His bowel movement was very much disturbed, loose, sticky, uh, and appetite was, she feels hungry for a couple of hours, but then too much of craving, which indicated a lot of pitta involvement was there, pitta nubandha was there, certain kind of vidagdha jirna, and even some urine related problems were there after chemo. She was lost the control over the flow of urine. So little bit of incontinence was also there. And the sleep was the main problem, as she was not able to sleep even 2 to 3 hours when she contacted us. So doing the Sattva-vardhan Chikitsa with the oral medications and other things, first of all, she started sleeping for more than 7 hours. That was the major outcome of this patient. As you can see, the past medical history, two surgeries were already been done on the right breast, two surgeries on the lungs, one in 2021 when they took one left lobe out and lymph node, one in 2024 for a biopsy. And she is the oldest of the four girls. Two died of cancer, one is skin and colon, and two of us still alive having a lung cancer. So this was the history that we obtained from the patient. This way we developed the timeline. Then August 21, how she started find out that she's having this breast cancer. Earlier she went to the doctor. She was not able to see clearly. So there was a diagnosis with the macular degeneration. And over that time in the scanning, she find out there was a small nodule in the right breast. Then this right breast carcinoma was there. She went for oral chemotherapy, radiation therapy, and every skin time. Then she developed the lung cancer in 2023. And biopsy relief, this was the case of metastatic CSL, which has no relation with the breast cancer, like this, and received chemo radiation in 2023. So this was the brief history of the patient. So over the side effects, the patient experienced the hair loss, weakness, neuropathy, digestive issues, loss of sleep. This was the major impact for the patient. And she was been advised this chemo and ephedrine and the immunotherapy. And you can see if undergoes immunotherapy or 2 years of lifespan with immunotherapy. So patient refused the further treatment of immunotherapy and started pursuing, for Ayurveda. As you can see, this was the another. So this patient also came down to Surat. We admitted her in Surat. We did some of the panchakarmas along with Shirodhara and all. And this patient, right now, you can see all this method of examination. This is the patient which came down to India. And you can see before treatment, this was the tongue picture. Overall, this patient is still under treatment. And you can see just within 1.5 months of treatment, patient changes in the tongue you can see. There was a lot of improvement in the overall this bowel movement, appetite, and the sleep part. Like right now, the patient is sleeping more than 7 to 8 hours. And main thing was in this the ati chintya and so much of emotional breakdown. What we able to understand was the main cause this patient had. So I think this patient came down in Surat around July or August last year, and patient is still under treatment. And we have been following every 6 months scanning. So this time we are able to see there is an increase of some 10 percentage of some growth in the lungs. But the patient in this there is no other metastasis. Usually, what happens with the lung CA that it metastasis to liver, metastasis to the gastric part or other system of your body. So this has not been happened so far. So just with the protocols of Ayurvedic medicines that we are giving, even in this, we are using the potali kalpanas like Praval Garbha. For the aspect of Shwaskas, we are giving Shwaska Chintamani Potli, Abra Garbha Potli. So even Suvarna Kalpa are being more majorly used, like Suvarna Malini Vasant are being given for the Rasayan aspect. So these are some of the medicines that we are giving in this condition. And a part of that, the Dhatu Chikitsa we are doing for the Rasa and Rakta. So focusing on the main nidana of this particular condition. Okay, now this is the another case of Kusht skin condition where you can see this patient came with severe tinea fungal infection all over the body and face from 3 years. And the beauty was here we have not used any oral Ayurvedic medicines, just the application. And later on, we started orally this Gandhak Dhruti only. The reference is Rasaratna Samuchay, where the Trikatu and Gandhak has been there. And the oil base is the Tila Tel. Majorly, you find Gandhak Dhruti in the Sarsav Tel and other form of Tel people are using. But we have followed strictly to the Shastra. And just after 5 days of application, you can see the changes in the skin color and lesion. Now, the interesting part I want to share here in Gandhak Dhruti, in some of the emergencies, when we get the patient of anorectal abscess, which turns to fistula, anorectal fistula later on. So what we have seen using this Gandhak Dhruti in the form of Basti Chikitsa, just 5 ml of Gandhak Dhruti in diluted in some Tila Tel base. If we are giving the Matra Basti of this, you see there is a resolution of the abscess in the anorectal abscess like condition. So it is not only the thing to be application or orally, but even in the basti form, Gandhak Dhruti can be used. Though I have not used so far in the Nashya form. There are some people who have been using this Gandhak Dhruti, even Nashya form, local application in the what do you say, throat like conditions that we have, severe burning sensation or the mumps like condition. Also, some people use it. Okay, now the last one of the cases, Vrana Chikitsa. This is the known case of liver CA and the metastasis case where the patient actually came for the Vrana. As you can see, there was completely a coat has been developed. And it might lend to sepsis and even can go for amputation like condition. So just following Vran Prakshalan with Panchavalkal Kwat and Jaloka Aucharan, we were able to give the solution for this particular thing. And later on, we started some medicines for liver, but the patient was actually on the treatment of chemo and radiation, and he wanted to continue that. So we just helped him for this thing for Vrana Chikitsa was been done in this case. Now, this is the last case we are approaching. It's a detail, but I'll try to brief it up. Now, this is the Ayurvedic approach to ischemic CV stroke, right middle cerebral artery, where the approach was Udavart and Amajina Chikitsa for the reversal of diabetes and hypertension with post-stroke medication cessation. Post-stroke medications are the ones we anti-epileptic, anti-cholesterol, and this blood thinners that we give, which we have patient has to continue for a lifelong. So in this, we were able to do the reversal of diabetes along with hypertension, and also these medicines were been stopped. And the interesting part of this case is this was my first case where we were able to reverse these conditions and stop the medication. And this case is actually of my grandmother when I started the treatment. So this was something where I wanted to see when what we are preaching, we are also following when it comes to our family. So that's only when we can say that we have faith in Ayurveda. So this diagnosis part, I'm just skipping it. So the history of the patient is 82-year-old female, widow. Uh, in 2019, she had this paralysis, stroke attack, where left-sided hemiplegia. Diagnosis was right middle cerebral artery, ischemic CV stroke with chronic UTI with accelerated hypertension and diabetes. There was ischemic, also at the same time hemorrhagic condition was there. And the condition was the patient was not with us. My grandmother was not with us. She was with my Masi. And at that time, she experienced in the morning and we got to know in the later afternoon. So in that case, there was also a delayed case where she was admitted delayed. You can see patient had a stroke at home in October 2019 and family members were not aware. So there was a delayed medical treatment. Earlier, we had some 2 months of Ayurvedic treatment for Amajirna, Udavat and Sandhivat, but stopped it as patient was feeling better and shifted to another place. And this presented with left side weakness, upper limb and lower limb since morning and slurred speech. Delayed hospitalization due to unawareness and late evening, and patient was been admitted only for 10 days in the multi-specialty hospital. And with that, you can see, yeah, hypertension and diabetes from last 20 years with hypothyroidism, severe osteoarthritis, anti-diabetic medicine since 20 years, anti-hypertensive medicine since 20 years, thyroxine since 10 years. Physiotherapy will continue over a period of 2 years post-stroke. Now, the interesting part was that every year the patient was having this Amajirna, Vidagdha Jirna, Vatarakt, and Udar Rog Samprapti. So that was our Nidan in this. Yeah, you can see this right MC ischemic stroke diagnosis of the hospital. This were the medicines were being given initially for 10 days when she was being hospitalized. And you can see even the cholesterol aspects, all these things were accelerated. This was the 6 point, his HbA1c was around 8.5 to 9 earlier. There was also some complication been occurred. D-dimer was been increased. Some severe UTI also happened. Uric acid also increased. This were all been managed with exclusively Ayurveda. Now, I think after immediately after discharging the medicine, we started more Ayurvedic medicines, and then eventually we stopped all the allopathy medicines with the advice of the modern doctors. And you can see his hemoglobin got raised, uric acid came down from 9.5 to 6.8. This was the follow-up after 2 months of CV stroke. And the important part was his fasting sugar was around 180 to 24. It came down to 108. Now, even now, right now, I think from last 1 year, we are not giving any allopathy medicines, not a single Ayurvedic medicines. And despite that, her fasting sugar used to stay around 100 and before 100, I mean 105 to 1010 is the maximum fasting sugar. And his HbA1c is also under control. You can see the following reports. Every 6 months, we are having all the scans for sugars, for kidney profile, liver profile, all these investigations we are having for every 6 months. These were all the medicines she was been taking. And you can see sugar even with anti-diabetic medicine used to be around 240, 200 plus. And this is all before past history. Now, all these medicines, modern Ayurvedic medicines are stopped since February 2021. So modern medicines have been stopped since 2021. And this Ayurvedic medicines have been stopped from 2023. And you can see this was the last report we had in 2024 26 when you can see HB1C 6.3, and all these parameters other than this are all under control, and she's enjoying all the diet, even she's eating ice cream sometimes when she fond of, and despite that his sugar used to remain controlled. And the important part is all those post stroke medications has been stopped. So that is something which I always curious like, is this medicines we have to take lifelong? Is there any alternative we have, or either we, when we focus on the nidana, the true root cause, are we able to do this reversal of this thing? So she was my first case when I was in my RAV, just completed my BMS. So this was my line of treatment. What we did was the Nidan Parivarshanam, strict diet and Vihar correction we did. Agni Chikitsa, Sanshodhan Viration was been done. Basti Chikitsa was been given. Sanshaman Chikitsa, where the line of treatment was of Vatrakta and Udavat majorly, and Nidan Parivarshanam. And the medicines what we have given in Deepan Pachan Praval Panchamrut, once again the Arkashir Bhavana based. In Kledahar Chikitsa Punanavadi Kwath was been given. For Anulomana Haritaki, sometimes depending upon the avastha, Grutbrusht Haritaki and Erenbrusht Haritaki was been given. For Mrudu Shodhana, we just use Avipattikar, proper dosage, as mentioned in Amlapit Chikitsa Adhikar in this Bheshaj Ratnavali. And Rasayan Chikitsa, we given Suvarna Malini Vasant for almost, I think, 8 months. And Hemagarbha Potli was been given for around 4 months, like that. And for Sattvaja Chikitsa, this Sattvavardhan Chikitsa of Brahmi Shankha Pushpi Jata Mansi was been given. So this was the only line of treatment was being followed. And though she's been bedridden because of the delayed treatment, she also had one stroke incident before that also due to the family unawareness. And just with this, we the patient is very much conscious, oriented. And the important aspect I want to share here now with all this post-stroke medication, what we see in the paralytic or the stroke patient, that the patient continues to remain in the this tamra, this avastha of delusion and not responding and completely in drowsiness kind of a situation. So when we just immediately stop these medications of this post-stroke, we were able to see this sattva was getting improved. He was been very much responsive and conscious, oriented. So that thing was been very much improved in just immediately stopping all these medications. So right now, not a single medicine. Sometimes some kind of Anuloman or some kind of variation has been given. But apart from that, not a single Ayurvedic medicine has been given since 2023. And this is one of the case out of 37 cases so far where we can say we have reversed complete diabetes in the post-stroke kind of situation. So this is the end of my discussion, end of my presentation. Thank you so much, everyone, for listening so much patiently. And thank you so much to organizer for giving me this platform to share my ideas and to share my few of the cases. Looking forward to the question answers. Thank you so much.
Yeah, thanks a lot, Dr. Ahmed, for such an insightful and enriching presentation today. Your expertise and knowledge have helped us with a deeper understanding on how the Ayur-Emergency, scope of Ayurveda in acute emergency conditions in cancer and severe critical illness can be helpful to all the doctors present here. So before we conclude, I would like to open the floor for any questions. Please feel free to raise your hand or type your question in the chat box, and Dr. Ahmed will address them. The Q&A shall be hosted and managed by Dr. Snehil Makwana.
Thank you, Anand. Amazing lecture, Dr. Ahmed. I can totally relate to you because being a student of Dr. Devchand Gala sir, we've been using Pradhamanasya in emergency, been using GS, Good Shunti Nasya. and all the criteria of abdominal examination, Jiva Pariksha, for assessing the patient and diagnosis. So it was an amazing session, eye opener for the newcomers and new students. Let's start with the question answer for today. First question is by, sorry, Pratyusha Mittal. By which kind of diet management and medicine COPD patient's weight increases? So what kind of diet you would suggest to a COPD patient to increase the weight?
So initially, in that condition, what we able to find out that this patient was doing a lot of this pragnaprad, uh, eating some kind of boiled eggs, non-veg, particularly dairy items, lot of sweets, and even sometimes alcohol also. So initially, what we did was the our chikitsa was completely based out of aptarpana. We wanted to reduce the this Ama condition, Amavastha was there. So we try to make it Niram Avastha. Once that was achieved, Agni got optimum. So what is my understanding that how we understand Agni got optimized or Agni has improved? Like from the very simple conclusion, if I want to draw out, we say BMS. If BMS has been improved, like for BMS, what I understand is B for bowel movement, A for appetite, M for micturition, S for sleep. So when we have optimum bowel movement, like regular bowel movement, complete evacuation has been done, satisfactory feeling has been get after that, appetite has been normal. Like after eating, there is no kind of udar or ura garavta is there, adman is there, any kind of udgar, something like that is not been there. Complete pachan has been there. Then in even in micturition, normal what Ayurvedic definition of normal mutra condition, what we have and sleep regular I mean early sleeping early on waking up and after that there is no kind of a morning stiffness or any kind of laziness is there you feel enthusiasm overall throughout the day to work. So when there is an improvement in the energy and enthusiasm you also see the improvement in the skin improvement is there. So after that we can start the bruhan chikitsa and in this bruhan chikitsa we just have given uh, particularly some Grutta Kalpana, particularly Shatavari Grut was been given. Because looking at the picture of Pitta Pradhanta was there in this kind of patient. So Shatavari Grut was been given along with Ashwagandha, Shatavari, other in the form of Churna also was been given. So only with this medication and the diet still so far, whenever we start milk, he might have some kind of disturbance with digestion, but we started with kheer, this made out of milk and rice was been given for the Bruhan Chikitsa. So this was the diet was been given for the gaining of weight.
The next question is from the same doctor. How we think in a patient having skin disease with itching and a main issue of having cuts over the tongue. How to treat that cuts over the tongue. Now the itching and the skin issues are being resolved, but the cuts over the tongue have increased.
Sorry, I was not able to get the question. Can you repeat?
Okay. Yes. So the patient's main complaints are cuts over the tongue, but the patient also has skin lesions with the itching. Itching has been resolved on the skin, but the cuts on the tongue have increased. So what to think about?
Okay, so I think this is something I have, uh, I mean, seen in my clinical practice that what happens usually when it comes to Kushta Chikitsa or particularly patient complaining of itching, Kandu. So certain things are very common. As we know, we give Mahamajishtadi Kwat or usually the Chikitsa is of Ruksha Chikitsa is there majority of the time because there is the skin, kapha when we think of major responsible for Kandu. So obviously our chikitsa is mainly been of uptarpana in that and more of Ruksha chikitsa has been planned. So what happened in this might be the okay, I think the responsible for increasing the cracks over the tongue. So I think after once you can see there is a resolvement of itching, there is no Kandu. So continuing the Ruksha and this Aptarpan Chikitsa might be increasing this cracks. Like majorly, I've seen that people use Vedanga, Katuki, and several other which are very ruksha in nature. So what happened in that? What we can do that we can start giving some snigdha thing which itself can help in kapha, scrapping lekhan thing. But at the same time, it is also a little bit of snigdha thing, which can do the snehana of the body. So after every chikitsa, what I believe is that we have to think of snehan chikitsa and the rasayan chikitsa, which is the ultimate end of your line of treatment or closure of your treatment for a punarbhava chikitsa. I mean, for a punarbhavata, when the patient shouldn't complain once you stop the medication, patients shouldn't start complaining again of the same issues. So I think just following the Snehan Chikitsa, she might see the improvement in this condition.
Okay, Dr. Mittal, hopefully you got your answer. Dr. Chahiti Rathi asks, Sir, in the case of encephalopathy, what was the thought process of using Mahatikta Grut in this case as it comes from the Kushtarog Adhikar?
Okay. So basically, Mahatikta Grutta, actually, so that's my whole point was we are not thinking from the aspect of encephalopathy diagnosis and choosing Mahatikta Grutta or any kind of other Ayurvedic medicines from that. Our thing was we were want to have some Rasayan Chikitsa as the patient had initially some of the Kushta like condition in earlier. And if you go for Mahatikta Grutta, and particularly Mahatikta Grutta from the classical text reference of Charak Samhita, in that Amlaki Swarasa has been used. In what majorly Mahatikta Grutta that you get in the market is they use Amlaki Kwata instead of Amlaki Swarasa. So even just changing this, just small, I mean, the measure of that, you will see a lot of improvement in several other things. So we wanted to correct his overall body aspects with all dhatu rejuvenation and all. So for that we started Mahatikta Grutta as it has basically can approach to all dhatus. At the same time, we had this important thing called Kandagraj Rasayana. So I think it was not only Mahatikta Grutta because we have also tried in some of the patient having premature graying of hair. I mean, Khalitya when it comes to us. So just for Snehan or Rasayan Chikitsa, when we use just Mahatikta Grutta, you don't get this optimum results. But adding this Gandak Raj Rasayana, even in the good dosage, I'll say we were using the dosage of 3 gram per day. So 3 gram to 6 gram of dosage, you see the improvement. I mean, if you go for 125 mg, 250 mg, 500 mg of Gandhak Rasayan, it will take much time for the patient to see the improvements, to see the changes.
Okay. Next question, Dr. Shashi Tiwari. Good Santinasya procedure, please guide.
A good Shunti Nasya procedure is what Gala sir's been preaching. That what I have learned from sir and from Hima ma'am. I think they are the best person to tell the procedure. What we are following.
Yes, so Good Santinasya is from the Sharangar Sanhita we follow. And if required, we can share the video how to prepare it and how to make it for the daily purpose. I'll try to find out the link and we'll share in the chat box. Next question from the Sudarshan KP. Sir, we should not cure Kushta Rog, right? It's their karma. I'm not sure of the question. The sir, we should not cure Kushta Rog, right? It's their karma hai na? Acha. So maybe the question is that it's a karmaj vyadhi, Kushta Rog, so we should not cure. Sudarshan sir, please, if you want, you can unmute and ask your question because question is not clear. For me also, I'm not sure if Dr. Ahmed is clear with the question. Sudarshan sir, if Anand sir, please, if Dr. Sudarshan can be unmuted and ask his question directly.
Yeah, I'm just trying to allow him to unmute. Just a minute, please.
Okay. Till then, we'll take a next question. Kindly explain about the method of rubbing of Hemagarbha Potli in the Madhu. How can we get that small vessel-like appliance you have shown in the case?
Actually, we don't have any this kind of appliances. Usually that rubbing stone that we have for rubbing chandana, which we apply over the forehead in some many of the temples that we have, the same is we ask the patient to buy it, which is very easily available. And in that we ask the patient to, depending upon what is the anupan with what you want to give in which avastha, which condition, either madhu, grut, or any kind of swaras or quat can also be taken. So certain drops of that, and in that we ask the patient to rub it in a fashion of circular rounds. And circular rounds of this thing is in such a way that in a diameter of 10 rupee or 1 rupee coin, if you are following that particular diameter, and by one round, circular round is equivalent to 1 mg. So depending upon the avastha, uh, 10 rounds. So initially hemagarbha potli, if the condition is not that much chronic and not much severe, pradhanta is not there, even 10 mg of hemagarbha potli is enough to give you the result. But in certain conditions where we see, and even understanding the prakruti, because what happened majority of the time, people think rasa ushadis, when you want to use even potali kalpana, bhasama kalpanas, or this kharli rasa, and any of the rasa ushadis, people think we do not have to think the prakruti or the agni avastha of the patient. It is not like that. You have to consider the agni. You also have to consider the prakruti, the dosha avastha, because hemagarbha potali is very and Krishna. So you won't be able to have an idea that even giving excessive dosage of hemagarbha potli can lead to the hemorrhage of the smaller arteries or the smaller vessels. So you have to be very careful. Because in one of the Marathi book of Gunesh Shastri, if you read the hemagarbha potli description in that, they say by putting a hand on the nadi, because it increases the nadi gati. So just putting a hand on the nadi, examine nadi, you have to give hemagarbha potli. And because it can increase the condition like tachycardia, and it should not be given in the condition like tachycardia or in the increased pulse rate like conditions. So you should be very, even in the jwara avastha, in very acute condition, like in the first stage of jwara, it should not be given. So you should also be aware of the indication and contraindication of any medicines. So like that hemagarbha potli, when it's been rubbed in circular rounds, that can be done. So in my kit, if you have seen, that we were not having enough space for keeping that huge rubbing stone. So what I did, the small khalva you can find out in the market. So on the back side of that khalva yantra, we were rubbing this. That was equivalent to that 10 rupee coin diameter size. So on that we were rubbing, and we were asking the patient to leak it and put it sublingually. I hope it answers your questions.
Okay. Dr. Sudarshan, can you unmute yourself and ask your previous question about the kushta? Okay, let's move on to next question, similar to what you have explained already, doctor. Sir, does it affect or have a bad effect or side effects of any case using more amount of rasa aushadhi at a one time?
Definitely, we do come across certain uh, things. I mean, either subjective or objectively. So that's why I mentioned that we need to understand the prakriti and the avastha of the patient. Sometimes there you might see that whatever dosage you are giving, it is not sufficient enough. So you have to increase, or either with increased dosage, you see some of the complications, some of the avastha is there. If the because if you are using certain potalies like about based out of Manashil, Shila Garbha Potali, or Hemagarbha Potali, Tamra Garbha Potali. So these are some very Ushna Tikshna Ushadis. So you will see some certain complications of increase of Pitta Adhikya like conditions. Brahmavastha, you can see some kind of daha burning sensation in particular part or throughout the body can be observed. So immediately you should have its antidote, and you can just immediately starting that you'll be able to resolve that complications or the issues. So that is not a problem. If you are very much aware of when to use, how to use, and particularly with what thing you have to use, anupan. That's why anupan is important. So even in certain conditions where we are not able to use this kinds of potli, but with particular anupana, we use gulab gel in some of the pitta like conditions. We use particularly go grut. So that will help you to elevate certain ushna or tikshna elements of that particular aushadhi. So that can be taken into consideration.
Okay, perfect. So I have put the link of preparation of good shuntiness in the chat box for anyone if you want to refer. Next question is from Dr. Shilpa Doka. Nowadays, overthinking is seen almost in 80 to 90% of the patient, which leads to dosha imbalance, like you spoke in your cancer patient from the Paris. What medicine have you used in such situations?
So, very good question, because either it is a case of a Kushta or cancer, we see stress is one of the important factor. So, obviously, in that I try to understand what is the psychological uh, overall, behavioral pattern of the patient. Majority of the patient is into overthinking. So ati chintya, what we define as, and obviously ati chintya is one of the root cause for rasadhatu shay. So your line of treatment, majority of the time you have to think of adding rasadhatu pachak and adding sattva vardhan chikitsa, certain elements for having a good quality of sleep, at the same time reducing the thoughts process of that patient. So like Brahmi, Sankhapushpi, Vacha, Chatamanchi. Um, so I want to share you one of the very good you can say guru given medicine. I mean, the formulation was been given by Vaidya Tapan Kumar sir, where what he did, he have taken Rajat Basma, and he Rajat Basma was been pounded. I mean, it was given it was triturated with the Jatamansi, and for several period of time. And that sukshma aushadhi is very common in Maharashtra and some of the part of the India. The sukshmikaran principle was been achieved here with Jatamansi and Rajat Basma. And this was been given to the patient of this kind of too much of stress, sleep, insomnia like conditions, where just a pinch of this medicine was been kept on the tongue, and patient was been found to have a sleep and stress reduction immediately over the tongue or sublingually. So even this principle can be advocated. Rajat Basma, the Sukshma like Pravala, Rajat Basma, or Godanti. And then there are like Mukta Shukti. So these things can be taken, and with certain Kashta Ushadi, depending upon the Avastha, once again, what is the dosha or the conditions, Agni Avastha, accordingly that you can, formulate. This is the beauty of Ayurveda, what we can do, personalization, and you can give it to the patient and you can see improvement. I think that should be the part of your treatment. Either you are having Agni Chikitsa, Dosha Chikitsa, Dhatu Chikitsa, based Chikitsa, whatever Chikitsa is, but Sattva has to be corrected. And that you cannot encounter in the first phase of your consultation. Later on, you will be able to find out these are the mental elements or the aspect when involved.
Okay. So Dr. Mittal has continued the conversation of cuts over the tongue. He has said that he's been applying Shuddha Grit locally for the cuts over the tongue. So if you want to add anything, or we can take next question. As you have explained already how to use the rasayan and uh, other
I
chikits.
want to add one small thing over here, that sometimes what happens locally doing the Snehan Chikitsa, like by in the mode of Abhyang or several other measures, internal Abhyang is very important. So I think instead of just applying, I think that Gurta should be given orally also.
Perfect. So next question, Dr. Harshit Gorana. Good evening, sir. Sir, in the case of emergency or in the Amavastha, how Rasayan Chikitsa or medicine would work?
Rasayan can only be given later on, once Ama Samta has been reduced to Niram Avastha and Agni has been improved. Only after when Agni is good, the Rasayan Chikitsa should be started. Initially, Rasayan Chikitsa, in my way of practice, I don't start even initially. It's first the Agni Chikitsa that we have to do. Correcting the Agni, correcting the Udavart, correcting, bringing the Anuloman Gati of the Vayu, correcting the Dhatu, or breaking the Samprapti. That is should be your line of treatment initially.
Okay. Similar question by Dr. Rathi. Sir, in the case of encephalopathy or any case in which patient is already hospitalized, when it comes to use directly Rasayan Chikitsa, how Deepan Pachan is being done, as modern pathy or even the patient do not allow or wait for long time to do Deepan Pachan, or without Deepan Pachan, Rasayan Aushadhi is given. So you have already explained, but if you want to add anything.
Absolutely. Absolutely. I've already explained this thing.
Okay. Contents of your eye drops from Dr. D. I'm not sure of the name.
So basically, the contents are as such. Let's show it. I'm be having it. So basically, it's a Arka-based Kalpana. Though it is the only one of the Kalpana that we are preparing so far, which is not Shastro, but it has a base in Shastro. The thing is that we have taken 40 Netra Rasayan Dravya, and this Netra Rasayan Dravya are based from some of the Vriddha Vidya Chikitsa Parampara, and the contents are based on some of the observations that we have taken and the I mean, you can say an R&D that we have conducted. So it is Triphala, Palash, Pushpa, Ludra, Shatavari, Tuth, Rasak, Tankan, Punarnava, Gulab, Yashti Madhu, and Daru Haridra. So these are the 14 Nitras and Dravya that we have used for preparing the Arka out of it, and we are not adding any preservative into it.
Okay. You have taken any reference, doctor, from any Samhita?
So it is not a direct reference from any Samhita. What we have tried based on the available sampraptis that we get in our clinics. So we there is some of the references where people were preparing out of Punarnava, Shatavari, like that. All these dravyas are netra and at the same time rasayan. So we have just it's not just a cocktail based thing, like we have just combined this thing because out of that there are so many other dravyas out there. So it is based on some kind of principle that we have followed, that it is basically at the same time not much I mean rukshita when we are using regularly. So our purpose was that people who are having more screening time or who are working in IT sector, so what's something that we can be using or instilling easy to use, like just instilling a drop on a daily basis for the Rasayan aspect. So in that aspect, we have taken consider that if this particular arc of this particular dravya are given in this combination, it will not cause any kind of a problem. And we have been using this Netra Rasayan dravya, I mean Netra Rasayan eye drops since 2019 from the first COVID wave. And people are been using since then and have no problem, like regularly. So like that, we have developed this combination, not direct reference from the Samhitas or any other classical text.
Anand, 3 more questions are left, and it is already 10 and 48. Should we go ahead and take these questions, or we stop?
Let's go ahead with one more question, last question, and then we can stop there.
Okay. So for other questions, your questions will be copy pasted to Dr. Ahmed, and he may answer your questions later. So next question again is from Dr. Mittal, and he is been discussing a case, 4.5 years boy, high grade fever, and then developed encephalomalacia. Now he cannot walk, cannot speak properly, eyeballs rotated up and down, can't fix his vision at one. Can you please suggest how to go for the line of treatment in this case?
To be very honestly, there are certain other history aspect we need to know before jumping to this. I need little bit more detailed history of the patient.
Okay. Dr. Mittal, you can copy paste the WhatsApp number if Dr. Ahmed allows it, and then you can contact him directly for the suggestion. Is that fine, Dr. Ahmed?
Yes, definitely. I've shared my number and also sharing the email address.
Yes. So for remaining two questions from Dr. Induja and Dr. Asha Kote, you can please directly contact Dr. Ahmed Savani. He will clarify and rectify your queries and questions. Anand, over to you after the question answer session.
Yeah, thanks a lot everyone for your active participation and engaging questions. We hope you found this session very valuable and informative. Once again, a very big thanks to Dr. Ahmed Savani for sharing his expertise with us today, and thanks to all the participants also for joining us. We look forward to seeing all of you in our next Gyaan Vardhini session, which is scheduled on 26th of March to be conducted by Dr. Satyavati S. The topic is discovering iridology as a deepening of Netra Pariksha, something that Dr. Ahmed actually mentioned today. So yeah, that's upcoming, and you can also join our spam-free Gyaan Vardhini WhatsApp community to keep on getting more updates on our upcoming webinars. And I've also shared the YouTube link for our videos, which gets uploaded in the next few days' time. So thanks everybody, and wish you all have a wonderful evening. We'll be closing the session now. Thank you. Thank you, Dr.
Thank you so
Ahmed.
much.
Thanks again. Yeah.
Thank you, everybody.